recording and reviewing history. So starting from the main board, the first thing you're going to want to do is sign up for a patient. You simply come to the appropriate column, attending, resident, mid-level provider, and click. If you suddenly realize that you've signed up for the wrong patient, you come over here to the patient information column, which is the date and gender, or rather age and gender. You click on that. It's a link to their patient information. You can actually change a lot of stuff in here, but don't be tempted to do it. Go and remove your name. Obviously in the live system there are a lot more choices. And that takes the name off here. If you sign up again, or if you sign up over the top of another physician, if I, for instance, replace Dr. Davis here, then you'll see it will be in bold. And that's all the information it gives you, is that it's not the first attending. First attending here with normal type, bold, not the first attending. This also gives you quick information or quick access to the patient's date of birth and other relevant information. You can see that there might be some other things filled in here if this were a live patient. Many times you'll want to kind of think about your patient's history first. In the live system, in this column here, there's something called a rapid clinical record, which looks like this little yellow clock icon with the backwards red arrow. If you click that, it will take you to a screen that looks like this, shows you all the various, these are all clickable links in the live system. And you can read the summary reports or the full ED report for any of their visits. On occasion, this doesn't actually work, and one of the most reliable ways actually to get that information, even if the rapid clinical record is absent, which sometimes for reasons we have not yet determined, it is absent. You can go to all and choose their visits. That is not currently active because I don't have a patient selected, so you have to make sure you've got your patient selected, and then you go to all and visits. This is going to probably be blank since this is the test system, and Smith Baby Girl has never been here before. All you see is this current visit. But if you wanted to review if there were anything else here, this is obviously just going to show us the visit today, but strangely you cannot click on this to just take you to the chart. You have to choose here. I generally choose physician chart and click enter, and that will take you directly to the information from prior visits, even if the rapid clinical record is missing, because it has all the information that lives in Picis is always available, even if you can't get back to the, again, rapid clinical record, but that is pulling information from our root system, and sometimes it has a hard time doing that. Another aspect of history is, we'll go in here, and then we'll start talking about how to enter the information for today. This book right here is the patient's medical history, which pulls forward from visit to visit through the emergency department. I'm going to click on this and it's going to be blank because this patient is a dummy patient in a dummy system. But in a live patient, when you click that, it's going to take you to something that looks like this. And this part, I'll actually just set it over here. This would be sitting right over here. You can see how those little gray lines line up. We'll pretend this is his history. And this would be, it comes through for every single visit. So you could scroll up this way and you could see from the most recent visit, you can scroll down and see prior visits. The reason I selected this one is we used to have a problem where every time the patient came, it was reduplicating the history. So you can see here, patient is a former tobacco user, smoked cigarettes, quit smoking greater than 20 years ago, and then it says the same exact thing again. Oh, and by the way, opiate and marijuana. You can edit these. You would be able to click in here, edit, and take or leave as much of this information as you want. You can take out stuff like notes because that just comes in from clicking boxes. You don't have to. It doesn't really change the information content. And then you want to click the enter button for whichever visit you like best or whichever visit you chose. And then that will drop this back over to this side. Obviously, that's not the same information because that's not actually how we did it. All right, so now you're in here, you know a thing or two about this patient, and you want to enter their history of present illness. You're going to go to this icon, obviously this would be blank. In fact, let's go to a patient that doesn't have anything written on them. So, let's try little Jimmy Jones. So nothing is entered here, although I've previously used him as a demonstration for review systems. I generally use the blank or dictation. I'll actually take you over here and show. When you click the history of present illness, there are a lot of choices. The advantage to choosing something specific is that it's going to ask you potentially relevant questions and prompt you to include information that you might otherwise have forgotten. You can choose the interactive diagnoses button. It will offer you some education or thoughts on what might be relevant for this patient. This is risk management software. These stop signs, they don't care what you say. They just want to make sure that you ask the most important questions for managing high-risk conditions. And then the icon turns green. If you don't answer it, it stays red, and it suggests that you should go back and choose that. Here you can see these little keys have information also related to our risk management and pop up some useful and interesting things. You're welcome to use those if you want. Many people prefer to keep it a little briefer. You also should understand you do not have to click something in every one of those territories. Most people use either the general or the blank dictation. General contains everything that's in the blank dictation plus a few other things. Again, these help you remember to enter everything that a coder might like to see and to make sure that you're entering a complete history without leaving information out. Blank dictation is the simplest way to go. So you just type patient brought by parents for evaluation of right lower quadrant pain starting gradually early this morning, now severe with emesis ×2, fever, chills, and whatever else you want to say. Chief complaint is right lower quadrant pain. Maybe the kid also told you some things. Mostly it was his parents. EM caveat, mostly not applicable to most people. However, you could potentially say that it was limited by age because little Jimmy is bashful and doesn't want to answer questions. That has covered my enter button, which is there. So that drops that over here. If you want to edit, you choose the subheading. If you suddenly realize that you wrote something wrong, this is a quirk of the Mac. This appears to be blank, but it is actually willing to edit this. You can copy it, paste it in, and you can edit it in whatever way you felt you needed to, and push change. If you hit reevaluation, it's going to drop in another copy, including all of this. It's going to leave that just like it was, but you mostly probably want to change. And again, that's a quirk of the Mac. After you've entered the history of history of present illness, it's going to drop you down into the next section, which is the past medical history, which is what we just talked about. And then if you're starting from scratch, you'll get this history boxes here that are very easy to enter. You can say he's up to date, he has no asthma or diabetes, and he's never had surgery. He's secondhand smoke. By the way, these little buttons here, this is called a miniature macro. I talked in an earlier video about how to make macros. All you have to do is hit the save button. That's the little tiny disk. You hit save. if that's something that you anticipate you might say again and again in the social history. And then you hit this, and at any point you can just drop it in, and that way you're not typing it over and over again. So you may have miniature macros in certain specific fields. Obviously you don't want to actually repeat yourself, but for the purpose of demonstration, that's fine. By the way, some people use Dragon, and that's great. I use it myself. Some of these boxes will take Dragon dictation directly, and some of them you have to dictate into the Dragon pad and then drop it in, because for love or money, they will not take dictation in certain fields. Again, that's a quirk we haven't quite figured out. All right. So, after you've finished with this, again, it drops you down into the next section, the review of systems. This you can see has been used, so we're not going to worry about that too much. But in this kid, we obviously wouldn't have a normal GI. We'll just delete that. And we'll say CHPI. Physical exam. He's uncomfortable. This is another one where I have a lot of miniature macros. Uncomfortable, non-toxic, mildly ill appearing. You just, in the first round, want to enter things that are pertinent or abnormal for this patient. So let's say he's a little dehydrated, pharynx is fine, but he's got tachymucous membranes. And then down here, he's got moderate tenderness to palpation in the right lower quadrant with localized rebound, no guarding, normal active bowel sounds. And then down here in the psych, he's apprehensive but cooperative. That's one that you could potentially save as a miniature macro so that you could use it again. And then you're going to hit enter, and you're going to see that's going to make an extremely brief physical exam over here. After you get to this point, which is the history of this visit, you're going to want to go over to your macros, and you're going to want to drop in your brief review. You can see that I've already done that, so it didn't change anything, but now I'm going to drop in my full exam on an adult. You can see where the macro was because it's yellow. Those are the things that just got dropped in. You can also see that anywhere I entered information blocked out the normal stuff from the macro. So you enter the abnormal or relevant things from for this particular patient's exam, and then you use your macro, which drops in the other things, which, since you didn't enter anything initially, you can presume are pretty much normal. His arms and legs are fine. He's neurologically non-focal. His skin's warm and dry. Anything that is normal, the macro just drops in over the top, and again is prevented from entering normal information in the areas that you specifically addressed because there was already information there. If you suddenly realize, oh shoot, I've got all this stuff on the wrong kid. I'm talking about little Jimmy, but I actually meant the little girl with the vomiting. You can move. This is only available when both patients are still on the board. So here's all the documentation you've put in on this kid. You're going to choose it all. And we're going to move it over. You've suddenly realized that we're going to put it on Baby Girl Smith. And then you just click Move. And it will take all the documentation that you selected and move it over to Baby Girl Smith and bring you to her chart because it presumes that that's where you were trying to go. So there's the history, the review, the physical exam, everything that you entered there. if you can see that I had some other things entered on baby girl, so if you suddenly realize that you just wanted to delete it, you can choose delete. While the patient is on the board, you can wholesale delete things. You can just say the whole thing was a mistake and I just want it gone. You can hit delete. If you don't realize that something is wrong until the patient is off the board, this delete option under actions will no longer be available, nor will the move option, and you will have to painstakingly go in and just say, oh shoot, you just have to individually click these and delete and click it and delete, back and forth and so on. If you have already signed the chart, you cannot change anything that's already in there. All you can do is go in to whichever section you've suddenly realized you made a mistake and signed it, and put an addendum. That will hopefully change in the next iteration. That's supposed to be much easier and much cleaner when we go to the next version of Picis, which is coming soon. All right, let's say you're documenting on this patient and now bed control calls you and they want you to talk to a doctor who's sending somebody in from an outlying facility. You can go and open a new window, or new session it's called when you're on the PCs at work, and you want to go to the same place you've been for, which is the Picis train session. Sometimes there's some bleed through between these two sessions, so watch out. You want to always go back to the main board. So now I've got 2 sessions of Picis open, and they want to tell me that they're sending a patient in. So you click the call in button, which is up here, and they tell you that Mr. Hernandez is coming in. He was born September 9th, 1946. And they think he's having an acute MI. They're shipping him in from somewhere by ground, hopefully by air actually in that circumstance, and TPA has been given. Physician calling in is Dr. Brown. You enter that. Now Mr. Hernandez is up here. Back to the main board. If you've already taken a call in on somebody earlier in the day, you took a call in on ER test, and then you realize this patient is actually here. The triage nurse should do this, but sometimes they don't. It's very simple to merge the call in. You can see this little telephone icon indicates that this person had a call in and then it was merged, but they don't automatically merge. So you know that ER test was called in earlier. You go to the call in area, and right up here, there is a merge button. You click that, and you say, I would like to merge ER tests that I took the call on earlier with this ER test, because they are the same person. And then way down here, not normally obscured by my Mac icons, we'll see if we can get to that merge button. Nope, we're going to open the dang nabbit. Hold on a second. All right, there we go. Now I can hit my merge button. Let's see if that worked. That was a little bit odd. Sorry about that. It does seem to have pulled the person out of there. Yes, so you can see the telephone icon is there. If we go into the ER test patient, you can see the very brief call-in note, because all I put in there was the name. But anything that was entered by the physician or by whoever took the call-in note will appear right at the top of the charting or you can see it coming by private auto, chest pain from the primary doctor. Dr. Kemling was the person calling it in. The other thing that having 2 sessions open for may be useful for is you're in the middle of charting on baby girl Smith, and the nurse comes and says, can Mr. So-and-so have another dose of Dilaudid? So you can potentially go to Mr. So-and-so's med services and order him some hydrocodone while you're, without getting out of baby Smith's chart. You do want to watch out because we do sometimes have some bleed through where you think that you come back over here to baby girl Smith, and then when you move to a different area, you thought baby girl Smith, you hit her med services button, and it will sometimes pop you over into the other chart that you were working on. So it's best if you go back to the main screen from both of those if you want to have 2 sessions running at a time. Okay, I think we're almost done with that. I'm going to close that second session. And that's about it for getting old history and making new history. Thanks.